First and foremost, I want to be a member of the community of the Grand Strand. I want to be a community cardiologist, and that means really listening to families first and foremost, to listen to their concerns and make sure, even though I'm looking at the medical aspect, make sure all of their concerns are addressed in each visit. And to me, that really means listening and then taking the time to absorb those concerns and then address those concerns in a way that families can understand and they can interpret, and then be readily available if they have follow-up questions, if they think of questions after they go home, to have a way to get back in touch with my team and then myself if that is something that the family needs. And that can be in the form of a phone call, that can be in the form of we can make an extra follow-up visit just to discuss a diagnosis or a lack of a diagnosis at the follow-up visit, or just emails. First and foremost, I'm a pediatrician and I'm a pediatric cardiologist with MUSC with special interest in cardiac imaging. So I'll offer full outpatient services as well as inpatient services to patients of the Grand Strand, and utilizing some extra training that I did in cardiac imaging to offer advanced echocardiography, specifically fetal echocardiography to the soon-to-be mothers that live in the Grand Strand. Special interest really in taking subspecialty care to an area that currently does not have it to the families up there, so they don't have to travel for every aspect of their care, the hour and a half, 2 hours, sometimes almost 3 hours, just to obtain care that now we're going to bring up to that area. So MUSC is the tertiary care center of the state, and that is where this you can think about it as the hub with little spokes going out. And here in the Grand Strand, we will have a hub to offer some subspecialty care in the Grand Strand. But MUSC is one of the best congenital heart centers in the country. I can honestly say if I had a child that I would send them to Charleston for their surgical care and keep that care in the Grand Strand for follow-up care and initial diagnostic studies.